Good morning. Glad you're with us on Mile High Living. I'm Gina Bellich. Going through life in extreme pain is no way to live. If you've tried multiple forms of treatment with little to no results, Pinto Chiropractic is one step away to helping you manage symptoms related to chronic back, neck, and sciatica pain. Dr. Glenn Pinto's goals are to identify the underlying cause of your health condition and to be a part of the entire healing process. Dr. Pinto, nice to have you here.
Thanks for having me on.
All right, let's talk about, so you've been doing this for over 30 years, and you have a certain approach, right, for persistent neck and back problems. What is your approach, and really, how is it different than others?
It's really simple. It's been an evolution. 30 years ago, traditional chiropractic was sufficient to handle most back and neck problems, but nowadays injuries and damage are much more severe to nerves and discs. So we've incorporated new technology, which we'll talk about in a little bit, which is able to handle the more difficult cases. Disc injuries, cases where people have been told that there's no help, they need medications, or they've even resorted to surgery.
So what are some of the complaints you hear from patients then that come in to see you?
The biggest complaints are obviously neck and low back pain, but a lot of times those have progressed into shoulder and arm numbness, pain in the low back, sciatica, sometimes even migraine headaches. A lot of times people come in and they've been diagnosed with back injuries, disc injuries, and they've been taking medications, and some of the patients have even decided that maybe they need surgery to solve their problems.
Well, you have helped lots of people, and we have some people, a few of your patients actually, that are super excited to say how they feel now. Let's take a listen.
I was suffering from lower back pain, sciatica, and I basically couldn't even stand.
I had excruciating neck pain.
What I was suffering from was low back pain and sciatic pain down my legs. Basically made my days pretty unbearable. I had been receiving traditional chiropractic care for many years, and it just wasn't helping anymore.
And I was working full time, so I decided to call Dr. Pinto. Saw the machine online.
The very first treatment, I felt relief from the most intense pain, and each treatment thereafter, it just decreases the pain more and more.
The DRX 9000 treatment was amazing. Within a month, I could stand straight back up and get right back to my normal everything routine.
If you have chronic pain, which I had for 37 years, and you know, they've offered surgery, everything you can imagine, medication, Dr. Pinto has improved my situation from a desperate situation. I have 5 daughters and 8 grandkids and a beautiful wife for 39 years. I want to keep going till 90, 95, and you could do it, I believe.
I just love his enthusiasm. They're all so excited because if you haven't had chronic pain, or if you have it right now, you know that it's miserable. I mean, you're just miserable. So how do you go about diagnosing this pain or the problem?
Diagnosing that, first we start off with high-end digital x-rays, which we do in the office. That gives me a really good idea of what's going on with the patient's spine. Many patients we will refer out for an MRI because that gives us a more accurate picture of what the soft tissue, of what those discs look like. It also gives us an exact idea of what level's involved so that we can be a lot more specific when it comes to treating those problems.
And then you go ahead and you explain this to your patients. How do you go about doing that? Because that's part of, I would think, part of the hard part, especially for people who have just been in pain for so long.
Exactly. Well, patients come in with their laundry list of symptoms. So I'll take a history, I'll do an exam, and then we'll have x-rays and MRI. So I'll bring them in, kind of go over what their symptoms were, then I'll show them what their x-rays and their MRI are. At that point in time, then I can correlate what they see on the x-ray or the MRI with their findings. At that point in time, then I'll give them a model so that I can explain exactly what's going on. So it would look like this.
Okay.
This is a spine. This is a model of a spine. This is normal. You have nice smooth vertebrae. You have a good looking cushion in between the vertebrae. Spinal cord's in here, and then there's plenty of room for the nerves. Typically after accidents or injuries, or even sometimes the wear and tear of life, some of these discs will become thin, which they'll see on the x-ray. It'll start to put pressure on those nerves. If this isn't corrected, it progresses into a next phase of degeneration where not only will it become rough and bony, which is called arthritis, but you'll also have these discs and these nerves will get pressurized. And so what we have to do is get the pressure off the nerves.
And let's talk about the DRX 9000 then. We've mentioned it, they mentioned it in the sound bites.
Exactly. So what the DRX does is it produces a negative pressure in the discs. It actually oscillates. It pulls and relaxes, pulls and relaxes. What that negative pressure does is it creates a vacuum, and it does 3 things. One, it takes the pressure off the nerve, which just feels fantastic. Number two, it actually, by the negative pressure, helps to reposition the disc. It actually helps to move it back towards center. And the third thing it does is actually helps to bring nutrition, fluids, nutrients, and oxygen to the disc, so the disc is actually in a healthier environment so that it heals better.
All right, let's talk real quickly about the great special you have for our viewers.
Sure. My special is real simple. A free consultation and exam with me in the office to determine where the problem is coming from. At that point in time, I can typically tell whether the person is a candidate for the DRX 9000. If they are and we have the necessary tests, then I will give them my best recommendations and give them some options and let them choose.
I love this. All right, Dr. Pinto, thank you so much. Call for your free consultation at Pinto Chiropractic with $325. Call 720-485-6894. If you're a candidate for treatment and are accepted for care, you'll receive $500 off your treatment plan. This is for the first 20 callers. To learn more, visit pintochiropractic.com. They paid for today's segment. Stay with us.